Samantha, how old?
33.
33. So let's say I've come and I'm reading outside the board. Samantha, 33, no previous medical history. Let's say I'm sitting in a GP surgery, FY2 doctor sitting in a GP surgery, about to see you for the first time. So no PMH, no drug history,
No.
and you haven't been to the doctor since you were like a kid.
Okay.
Yeah?
Mm-hmm.
Okay. Can somebody do like a timer, like an 8-minute timer? Would that be okay?
Yes.
Yeah? And does someone want to just give you a knock when it's 2 minutes? Would that be alright? Hi.
Hi.
Is it Samantha?
Yeah.
Hi Samantha, I'm Dr. Aman, one of the FY2 doctors in the practice. Nice to meet you.
You too.
How can we help?
So I've been having this pain in my elbow for a month or two now. And it's starting to be a bit of a getting quite bad at times, so I thought I'd better come in.
Okay, elbow pain is one of those funny things that people do get affected by, but you don't think about it until it happens to you.
Yeah,
so I'm glad
never had it
you've
before.
come in. So I'll ask you a couple of questions about the elbow and a few other things as well, and see what we can do going forward. It's really common to get elbow pain. It's something that we actually see quite often, so it's good that you've come and seen it. So let's start with the elbow then. A few quick questions. You said a few months, did you say?
Yeah, a couple of months maybe now.
So 2 months, 3 months?
Yeah, 2 months.
Okay, so a couple of questions about the pain itself. Is it there all the time?
No, it's not there all the time.
Okay.
Mostly just when I'm moving it.
Okay, so moving seems to make it worse.
Yeah.
When you're resting it, does it go completely?
Yeah, I guess once, if I've been resting it for a while, it does go away completely at times.
Okay, and have you tried anything yourself for this?
No, I don't like to treat things myself. I thought I'd better come.
Yeah, definitely. And I've noticed you don't come in very often, so if you're coming in, it means there's something going on.
Yeah.
So you're not trying anything else. And where exactly on the elbow is it? The elbow's obviously...
More around here.
Okay, just on that one side.
Yeah.
Other side seems okay.
Yeah.
Anything around the elbow affected apart from that one point? So anything around the kind of this area here, or down the arm, up the arm?
No images.
So other joint, shoulder okay, wrist okay?
Yeah.
Other side okay of the elbow itself?
Yeah,
Okay.
it's okay.
A couple of yes/no questions about the elbow. Any swelling that you've noticed around the area?
Nope.
Any trauma, injuries?
Nope.
Pins and needles, tingling in the arm at all?
No.
Okay, and nothing unusual like any weight loss or night sweats, anything like that at all?
No.
Okay, fantastic. And you and yourself are okay?
Yeah, I'm fine.
Good, no fevers?
No.
No recent travel?
No.
Okay, no previous joint problems or pain in the past?
No.
Looking at your history, I can see there's not really anything that we've got on our documentation here. But have you had any medical problems involving the joints in the past?
No.
Any general conditions that we don't know about?
No, not that I can think of.
And anything in the family that might be joint related that you know?
No, nothing in my family.
Okay, fine. So everyone's pretty good and pretty healthy.
Yeah.
Good. Okay, and because you've got no conditions, we have no medications here. And you mentioned you've not tried anything for the elbow. But are you taking anything else in general that you've got from anywhere else, or anything else?
No. Just
Okay, fantastic. Great. So that's a bit about the elbow, a bit about you. How's it impacting you? Because elbow we use all the time. So is it getting in the way of anything? How's it impacting your life?
Well, I work as a hairdresser, and obviously my arms are kind of moving all the time.
Yeah.
Need to be able to use scissors and things, and
Yeah.
I mean that's probably what's prompted me to come in.
Okay.
It's starting to, I think, slow me down just because it gets quite painful if I've been working.
Okay, yeah, I can see that hairdressing, and obviously you're using that like this all the time. And is there certain things that you're doing at work that make it worse? You mentioned scissors.
Yeah, I guess whenever I'm kind of cutting hair, just moving
Doing
it.
things, yeah.
Yeah.
Okay, fine. So that's important. We'll come back to your work, and it's obviously impacting things. Has it led to any time off or anything like that at this point?
No, not yet.
Okay. And are you self-employed, or do you own the hairdresser? Is it your own company?
No, I work at hairdressers.
Okay, so you're employed.
Yeah.
Fantastic. Okay, great. And what about at home? Is it impacting you at home at all?
No, not really. Can manage okay at home as normal.
Okay, good. Who's at home with you?
I live on my own.
You live on your own. So you're doing everything at home, I guess.
Yeah.
Okay, fine. But you've not needed anyone to come and help you. It's not got to that point where it's stopping you doing things at all like that.
No. I can do them when things at home.
Okay. Now, I've not met before, and a couple of things sometimes people do when they get pain for long periods of time that sometimes help. You mentioned you're not taking painkillers. Sometimes people smoke or drink alcohol to help with pain. Just wondering if that's something that you've tried for this at all.
No, I don't smoke. I have the odd glass of wine at weekend.
Fine. But nothing that's changed because of the pain.
No.
Okay, fantastic, great. Now, you've had this elbow problem for a while. What was going through your mind about all of this? Anything running through your mind?
Well, I don't know, there's different types of arthritis and things you see about. I thought I'd better get it checked.
Yeah, arthritis means inflammation of a joint, so I can see why you're thinking that. We'll have an examination and see. It's not usually at your age, but we can have a look at it.
Good.
Was there anything that was particularly worrying about all of this?
Well, a friend of mine's got, is it rheumatoid? And I know some of her joints, she really struggles with. She has to take time off work and everything.
Okay. Yeah.
So I thought I'd better get.
Yeah, I can see why that's on your mind, especially if you know somebody who's got that. And again, that's rare, but we can look at it and we can see if it's anything to do with that. And now you obviously come here. You don't come very often. Was there anything in particular that you came here for, or that you wanted from us?
Well, I know there's like different scans, like MRI scan. I thought I probably need that to really have a look in there.
Yeah, reasonable thought. I mean, we do MRI scans for joints and things, and maybe once we examine you, we can have a chat about that. But before we chat about all of those things, there's a few things to have a chat about. Do you mind if I have a quick look at the elbow? What I'll be looking to do is have a feel around the joint, do a few movements, get you to do some, I'll do some myself, look for any swelling, and perhaps look at the wrist and the shoulder as well, and then compare it to the opposite side. Would that be okay?
Yeah, that's fine.
Good. Just for comfort reasons, I'd like to get somebody in with us if that's all right.
Yeah, that's fine.
Alongside it, if that's okay, I'd like to start.
Okay. So tenderness over the lateral epicondyle.
Okay, great. So thank you for that. Thank you for answering my questions. I know I asked a lot of questions, and thank you for letting me examine you. You're right. When I examine the elbow, the good thing is there's nothing there that worries me. There's no redness, no swelling, no stiffness. But you're right, when you press on that one area that you were mentioning, it's called the lateral epicondyle, it's quite tender, isn't it?
Yeah,
it's quite sore.
Sore.
So I think we're dealing with a really common condition. You might have heard of it, something called tennis elbow. Is that something that you've come across yourself in the past?
Yeah, I've heard of it, but I don't play tennis, so...
Yeah, I mean, a lot of people actually think that. I mean, tennis elbow is found in people who do repetitive use of things that are using the elbow quite a lot. For example, hairdressing. So it's a very common problem. It's generally not something to worry about too much. So there's lots we can talk about actually. There's a few things I think that we can have a bit of a chat about. Obviously we can talk about tennis elbow, treating it, what are the options. There are a few things that we can go about doing. I'd like to talk about your work, because obviously it's clearly impacting your work. You mentioned your hairdresser, and maybe we can look at some things around that side of things that can possibly help. You mentioned you were worried about rheumatoid arthritis. I don't think from talking to you that's something that I'm worried about right now, but we can certainly talk about that. And you mentioned an MRI scan, and that's usually not something with tennis elbow that we tend to do, but we can talk about that and explain why that perhaps is not needed at this particular point. So there are a few things to have a bit of a chat about. Was there any of those that you want to focus on right now as we start?
Maybe treat it then, if there's something we can do to reduce it.
Well, there are a couple of things that we can do. Rest is an important thing, so maybe looking at some time away from doing those movements for a short period of time can often help. That's something that we can think about. But also we have lots of treatments, whether it's topical gels that can be for painkillers, some people like painkiller medication, and depending on what you might be looking for, we can think about some of those as well. Did any of those? Good. Thank you for Tyrene. What do you think?
Yeah, went very fast. Sitting in the hot seat. But no, yeah, I thought you were able to get what was going on in my mind, what I was worried about. I wouldn't have mentioned the rheumatoid thing if you hadn't have asked. Yeah, that would have been something I'd have gone away and worried about if you hadn't have covered it. Picked up on the fact that it was really bothering my job now, slowing me down at work. So yeah, I felt like really good.
Can you see how a tennis elbow case can be? It's just tennis elbow. Like, it's obvious from the beginning it's tennis elbow, isn't it? And anybody can go in and make that diagnosis within 20 seconds and treat it and give you all the treatment options. But the difference that we keep talking about is what we just demonstrated now, all the other factors that come into a case. The mind, the life, how you understand them, and then how you bring them back into a management plan. Now, in 8 minutes, I've not got enough time to manage the work problem or manage the MRI scan fully or have a debate about rheumatoid arthritis, but I've got enough time to show that that's on my agenda list, that I've acknowledged that these are some things that are also important in this case, then I'm aware that these things are also in the background. It's not just about what drug do you want, what cream do you want, what medication do you want. Now, once I got to the point where I'd said these are the issues, because there was nothing clinically that I needed to jump into, I could then send it back. Where do you want to go first? And like most people, the first choice was, let's talk about how do I treat it. And then that gives me the opportunity to then expand on that, whether it's rest, whether it's creams, whether it's tablets, and then we start to get into that bit of the discussion. And then if the bell goes at that point, I'm happy. Because the case is not all about what drug do you give, it's about understanding the situation and managing it from her point of view. So hopefully that brings together some of the things we've been talking about for the last 7 or so weeks. Data gathering is about understanding the situation as a whole. The 3 bubbles you could see there, right? Those red flags, done. Make sure I'm not missing anything like swelling, trauma, redness. I can't miss those things, shoulder problems, wrist problems. Because if I miss those, I'm diagnosing too preemptively. Oh, this is obviously tennis elbow, I don't need to worry about anything else. That's the first thing. Then there's the psychosocial, there's the work, there's the home, other habits, but bringing it in from a relevant point of view, not just do you smoke, do you drink, who's at work, what do you do for a job? And then I went into the mind to understand, okay, I know this is tennis elbow, this is obvious for me, but I want to understand what's going on in her brain. Not just what's the cause, but the worries and things as well, and the expectations. Yeah? And then when you mentioned 2 minutes to go, I was just about at the examination point. So I now know I've got 2 minutes left to explain those 3 steps of management. Explain that you're likely got something called tennis elbow, offer explanation, and then get the issues on the table. For me, that's the priority, get the issues on the table. And what were there in this case? 4 issues. Treatment of tennis elbow, which we can talk about. There's the issue of the worry of rheumatoid arthritis. There's the issue of the work and how we might need to talk about that. And there's the issue of the MRI scan request. Yeah, so you say a couple of lines about each one, but don't get stuck in one until you've got all of them out. And then when you've got all of them out, you can relax a little bit and then send it back to the patient. That's your patient-centered, holistic management, where it's not just doctor saying this. Does that kind of make sense?
Yes.
Yeah? So we're going to work on that again as we go through the rest of the day, finish off the role plays that we have, and then we'll look at some prescribing at the end. Cool. Anything else to add, Jade?
Yeah, I think really good. I think if we purely focused on the pain, diagnosis, treat that, you could finish it within a few minutes, but
4 minutes done.
so much else going on.